Let's talk about the young girl whose life you literally saved. Recently, she had autism, was having daily seizures.
Yes. And what I focus on more is helping her to maybe transform the seizures that she had every day, multiple times a day, often, that were such a burden on her life, and by finding the disharmony and determining that that disharmony was because she could not degrade isoleucine. And those of you that know about proteins know that that's one of the 20 components of all the proteins we eat and all the proteins that make us up. So she could not handle that well. And when we found that, we, as we always do, look very carefully at the world literature, and there were only a few children ever described with this. We work with physicians all over the country. We favor a small number of visionary physicians really committed to their patients. And this happened to be a patient of one of those. And he developed a protein cocktail that was very low in isoleucine. It tasted horrible. But she could eat fruits and vegetables and anything that didn't have normal protein. And those seizures melted away. Those seizures that she had for years, they melted away. They were gone.
How old was she?
She was 12. And she'd had these seizures for years. And an important point is nothing took care of those seizures. But there was one drug that helped a little bit. She was on high doses. And we found another disharmony. We found that she was susceptible to a rare complication of that drug, liver failure. And when that happens, it often is lethal. So, luckily, she had not yet developed this, and so we took her off that ASAP, okay? And she is now on another drug just in case she falls. She eats some, normal protein. She has a little bit of a buffer, okay? But we took her off that. So, personalized diet, personalized drug therapy. Those are the most important things that this revolution, this next-gen based personalized medicine revolution